Ms. Moderator. It is 10 a.m. on my computer. This is Dr. Leah Tate, and I'm calling the September 22nd, 2023 Outreach and Communications Committee meeting to order. Ms. Pruteau, can you please call the roll?
Morning. Riscate? Rogers?
Here.
Tate?
Here.
And repeating, Riscate?
This is the moderator. I see that board member Riscate is logged into the meeting, so she may be having audio issues.
Well, let's give her just a few seconds to see if we can.
Sure.
Out here. Hello? Can you hear me now?
Okay,
yes,
we can hear you. Thank you. Quorum has been established. I would like to welcome everyone to the Outreach and Communications Committee today. I appreciate everyone is taking time out of their schedule to spend with us. I would just like to remind everyone that the Board of Psychology full board meeting will be held in person November 2nd and 3rd in Los Angeles for everyone who's making future plans. And as a reminder for the public, licensees, and our stakeholders, the goal of the Outreach and Communications Committee is to provide critical information to Californians regarding the evolving practice of psychology, relevant and emerging issues in the field of psychology, and the work of the board. Today's meeting is absolutely eligible for CPD credit, and Ms. McCochran will share with us how to document and obtain those hours for your records. Ms. McCochran, please.
Hi, good morning. Attending today's committee meeting provides you with CPD credit under category number 1, attendance at a California Board of Psychology meeting. For your CPD records, please notate today's date as September 22nd, 2023, and note that we are here for the Outreach and Communications Committee meeting. At the end of the meeting, I will announce how many hours you can be credited. If you called into the meeting, please email bopce@dca.ca.gov with your license number and the phone number used to call in. Again, it's bopce@dca.ca.gov. If you signed in using your computer or mobile device, your attendance is automatically documented and no further information is necessary. Back to you, Dr. Tate.
Thank you so much, Ms. McCochran. Is there any board comment on the chairperson welcome? Ms. Moderator, can you please open up public comment regarding the chairperson welcome?
Thank you so much. I'm opening up the Q&A panel, and if any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. And while we give you a chance to do that, let me check with our remote locations, or actually, do we have any public comment in the El Dorado room?
No public in the El Dorado room.
Okay, and let me just check. Are we also in the hearing room in HQ1?
Sorry, what was that?
Are we also in the hearing room in headquarters 1?
We do not have a... We are only meeting in the El Dorado room for HQ.
Okay,
Thank you.
Thank you. And then also I wanted to check with Board Member Riscottis. I believe she's in Oakland. Is there any public comment from Oakland?
No public comment and no public in attendance at this location.
Thank you. And throughout this meeting, you will hear me repeating that. It's not that I'm forgetful, it's just that I'm required to do that in case anyone has joined the meeting midway. So now I'll look at our list of attendees. I see Sheila Henderson, your hand is raised. Just a reminder, you will have 2 minutes to give your comment. I'll give you a 15-second warning. And Sheila, you should be able to unmute yourself. There you go, you're unmuted.
Thank you for this opportunity. I just wanted to verify this also qualifies for the legal and ethics requirement that we've got on our continuing education.
Hi, this is Lizelle. Unfortunately, it would not count for laws and ethics. It would just count under CPD category number 1, the meeting attendance.
Okay, so all of the ones that I've attended do not meet the legal and ethics requirement. I mean, I know you don't know which ones I've attended, but all of the ones do not. Okay, thanks.
All right, this is the moderator.
So, yeah. Sorry, 1 second. Just to quickly address that. If it's talking about, if we have a meeting regarding laws, usually board meetings and legislation and regulation, the committee meeting for that, that would count for the laws and ethics requirement.
All right, thank you. And I see no further requests for public comment. Shall I close the Q&A panel?
Yes, please. And Ms. Moderator, thank you for your help. And just for ease for this meeting, I'm wondering if it's easier for us to defer to the board staff and the board members at the various sites during the public comment period. And I can have them unmute if there is a public member who would like to speak.
That's fine. So you would like me to not ask for it, but just have them be responsible for checking in?
Absolutely.
Okay, that works for me.
Perfect. Thank you so much. I was just trying to think of an easier way to manage that for you. We are moving on to item number 3. This is public comments for items not on the agenda. The committee may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. And each speaker will have 2 minutes. And Ms. Moderator, can you please open up public comment?
Thank you so much. I have opened up the Q&A panel. Again, if you'd like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. We'll give you a few moments to access that. All right, I'm seeing no requests for comment at this time. Shall I close the Q&A panel?
Yes, and thank you very much. We're moving on to agenda item number 4. This is approval of the Outreach and Education Committee minutes from last year, September 23rd, 2022. And I hope the committee's had time to review these minutes. If they are a correct reflection of what's occurred, I would love to hear a motion. Board members?
Yes, hi, this is Shakanda Rogers. So moved, Madam President.
Thank you.
This is Ms. Riscotti, I second.
Perfect, I appreciate that. We have a motion and a second. I do not see any hands up for board members. Ms. Moderator, can you please open up public comment?
Thank you so much. I have opened up the Q&A panel. If any member of the public would like to comment on the minutes, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a few moments. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, and thank you.
You're welcome.
We're back to the board on this item. I do not see any hands up regarding approval. We have a motion and a second. Ms. Pruteau, can you please call the roll?
Yes. Excuse me. Riscate.
Aye.
Rogers.
Aye.
Kate.
Aye.
Thank you.
Thank you, and that motion passes. We are moving on to item number 5, the strategic plan update. Ms. Sorick, do you have an update for us? Ms. Sorick, if you're speaking.
Oh, can you hear me now?
I couldn't hear you before, but now I can. Go ahead.
Okay. Hopefully that's better. Included in the meeting materials is a strategic plan action plan update. And this document is updated at every outreach and communications committee meeting, as well as when the committee reports out to the full board at the following meeting. Action items that are updated are indicated in red font with action items that have been updated since the last action plan report. This is the last action plan report for the current strategic plan, which was from 2019 until 2023. The board will be undergoing the strategic planning process. Ms. Sinclair, who is on the line as our moderator today, will be our strategic plan moderator in December for that planning session. We have sent surveys out for the next strategic plan, but this is the update on the current plan. And then once the new strategic plan is adopted by the board in February of 2024, we will create a new action plan, which will be presented at the Outreach and Education Committee meeting next fall. So that is the update, a little chronology of affairs, and I'm available for any questions.
Perfect. Thank you, Ms. Sorick. I'm really looking forward to the strategic plan process. I haven't done it with the board yet, but thank you for the work on this. Any other board member comment? Okay, I'm scrolling through. Okay. Ms. Moderator, can you please open up public comment for agenda item number 5?
Thank you. I've opened up the Q&A panel. If any member of the public would like to make a comment, you can type comment in the field in the lower right-hand corner of your screen, or simply raise your hand. We will give you a moment. All right, so we have a attendee that says they can't hear the meeting. So me send them a message about maybe calling in for their audio. All right, and it is not letting me send that. That's interesting. So
can they type in the comment, or they just can't hear the entire meeting at all?
They say they can't hear the entire meeting at all. If I could have the co-moderator show slide 25, that gives directions for calling into the meeting. So perhaps that person, we hope they can at least see. And then while we show that, I have not seen any requests for comment. I haven't seen any raised hands or no one's typed comment in the Q&A. So shall I close the Q&A panel?
Yes, please.
Okay.
And thank you for helping that individual get connected to our meeting. Agenda item number 6 is the social media update. Ms. Whitney, can you please provide an update for us?
Good morning. Are you guys able to hear me okay?
Yes.
Okay. So good morning, committee members. The meeting materials in the packet for item number 6 is a social media update. So as discussed last year at this meeting, due to changes with Facebook Analytics, board staff are no longer able to track the likes and followers over time. We can only provide the current number of followers and see the most popular post in the last 90 days. And that is included in your meeting memo. And then Twitter recently changed as well to where we can no longer see followers over time, only current followers. So that's a new update. So the materials for Twitter include the current number of followers who are following and then total tweets for the board's account. New this year, we added the 2 CPD videos to YouTube. One was the animated version and one was the webinar. And the number of views for each are in your meeting materials as well. And then it also includes the views of our board and committee meeting webcasts for 2023 and 2022. So that includes agenda item number 6 as information only, and I'd be happy to answer any questions.
Thank you so much for the update. It looks like our CPD is very popular, which is completely understandable. Any other board members have a comment?
Hello, this is Ms. Escate. I was just wondering if it was possible for the next meeting to have the numbers from the previous meeting. So even if we can't put in a certain amount of time, we at least know what happened from the last meeting to this meeting to compare.
Sure, like a comparison from 2022 to like a comparison from today's date, 2023, to the numbers for 2024?
Yeah.
Sure.
And at least we know how much it grew over the year.
Right. Yeah. See the difference. Yeah, we can definitely do that.
Thank you, Ms. Riscate. Any comments, Dr. Rogers, before we move to public? Oh, there's your hand. I got it. Go ahead.
Thank you, Dr. Tate. Thank you, Ms. Whitney, for the update. I have a question. I know it has been brought up before, and I don't know if we've had any significant discussion around it. I recall at maybe our last committee meeting, a participant in the attendee section asked about whether or not the Board of Psychology has a LinkedIn page. And I was just wondering if there's ever been any discussion among board staff around pros and cons around a LinkedIn page. Would that be useful or beneficial? Just curious if there's been any discussion about that.
Hi, this is Antoinette. We did have a discussion about that, and I myself have a LinkedIn profile which we have used for posting positions at the board. I'm not sure how impactful that is. I've also posted information relevant to activities of our board, but it's something that we can talk about maybe during our strategic plan. You know, what benefit there may be as far as the nature of information sharing and the platform for that. I know, Ms. Riscate, this is your wheelhouse, so I'm wondering what your thoughts are on that, because we could, I think a couple other boards have pages on LinkedIn, like Physical Therapy Board, I think, has one. Ms. Riscate, do you have any thoughts on that?
Yeah, I think usually the LinkedIn is beneficial in the sense that it's attracting like people that are actively looking for a job, and they also have a goal of having a professional appearance online. So it kind of just makes some candidates stand out better. And so what I've found in my previous jobs is sometimes the candidates from LinkedIn are just they actually they're just a little more professional. They actually read the requirements, and also they follow more of the I want to say I guess the professional stuff. And so I do recommend having a LinkedIn, because even when you only get a few people responding, they're usually high quality people. That's been my experience though with working with a nonprofit and also at Stanford University.
Thank you for that insight. We will follow up with DCA and see if they can assist us in setting that up.
That would be great.
Thanks for that input, Ms. Riscate. And thanks for following up on that, Ms. Sorick. It sounds like it would be beneficial for the board.
Yes, thank you all so much for that discussion. I really appreciate it.
Any other board comment before I open it up for public comment? Ms. Moderator, can you please open up public comment for agenda item number 6, please?
Thank you. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. I do see that the attendee, Bruce Webster, is raising his hand, but he has no audio, so perhaps we can show slide 25 again so he can try calling in for his audio. And I'm seeing, I'll give it just one moment. Yeah, I see no other requests for public comment. Shall I close the Q&A panel?
Yes, please.
Okay.
And thanks again for working with
Sure.
you. Agenda item number 7 is the website statistics update. Ms. Whitney, please.
Thank you. So this item number 7, website statistics update, provided in your packet are the statistics from the date range of January 1st, 2023 through September 4th, 2023. The first chart on your materials shows the top 5 most viewed web pages on our website, not including our homepage, and the amount of views each one received. And then next you'll find some bulleted items, and they're represented by corresponding graphs for views by quarter, with the exception of the summer 2023 newsletter. That one's broken down by month for July, August, and September. And then the legislative and regulatory advisories are also listed by views from January 1st, 2023 through September 4th, 2023. And that concludes this information only item. And again, I'd be happy to answer any questions.
Thank you, Ms. Whitney. I have a comment, I guess, and I'm assuming it's more from Ms. Sorick. I see that the FAQ page is our most popular page, which makes complete sense. How often do we review the FAQs or add items to that page, since it is popular and I'm sure people are really trying to get as much information as possible without having to make a phone call?
Thank you for that question, Dr. Tate. So we have a website task force that meets on a regular basis. And what we do is we go through page by page at each meeting. We go through our website and we check for accuracy and currency. So we take turns going through each of the pages, and then we go through any necessary updates for each page during that meeting. And then we send those immediately to the website team, and they make that update for us. So we do go through periodic, I would say once every couple months, we go through each page extensively. We check all the links work, we check the verbiage. So it's a really helpful exercise for us to go through that, and we're constantly updating.
Perfect. I love to hear that. And thank you for giving me the information about the task force. Any other board comment?
Sure.
Hi, this is Mr. Scott. I also think it would be helpful to have information about where the people are coming from when they land on this page, so that we know what other referral link is most beneficial to putting information there. For instance, like you can see like how many people came from maybe a Facebook post, or how many people did a Google search. That's like the first step in like knowing where's the best place for us to put information when we're trying to reach the community.
That's something we can ask our IT department to see if we can get those statistics.
That'll be great. Thank you.
Thanks, Mr. Scate. Dr. Rogers, any comments to this discussion?
No comments or questions. Thank you.
Thank you. Ms. Moderator, can you please open up public comment for agenda item number 7?
Thank you so much. I've opened up the Q&A panel. If any member of the public would like to comment on agenda item 7, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We will give you a moment. All right, and I do see some requests for comment from Dr. Andrea Davis. So Andrea Davis, a moment, and I will give you the opportunity to unmute yourself. All right, Dr. Davis, you should be able to unmute yourself.
In the public, I had tried to make a comment through the Q&A on the last agenda item, following the instructions where it says ask field type comment, but I did not see that as an option. I only saw the names in the field type, so I just tried to type into the Q&A and it didn't. I don't think it got seen.
I apologize for that.
Would you like to make your comment?
Sure. I just wish I could be helped a little bit, or anybody like myself ask. We have options of all presenters, host, any particular presenter, host and presenter, but there's no option to choose comment.
So you type comment in the field and then you just send it to all panelists.
Okay.
Send it to all, yes.
And that didn't work last time around when I tried that as an option. Sorry, I don't want to take a lot of time because I know you're on a time constraint.
Sure.
Did that not show up?
Both of your comments are showing up now. So
perfect. Okay, they were live, but okay, we're just a little unsynced maybe. Okay, yeah, it was just simply that I wondered about. There's a lot of people leaving Twitter in droves, so I didn't know if in the strategic plan it might be considered to use a replacement for Twitter, because it has become sort of a political hot button issue to even use Twitter. If Threads is less political for the board to use for our outreach and communications. Okay.
Thank you. All right, I see no further requests for comment. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
And thank you for your comment, Dr. Davis. We appreciate that. We're moving on to agenda item number 8, and this is the update on the newsletter. The Board of Psychology Fall Journal was emailed out and is in the agenda materials for your review. And thank you, Dr. Rogers, for your addition to the journal. The next journal will be out during winter. Ms. Sorek, do you have anything to add?
To repeat that the fall journal is included in the meeting materials, and the next journal will be going out in December of 2023.
Is there any board comment regarding the newsletter? And again, thank you, Dr. Rogers, for your article.
Of course, happy to do it.
Keep them coming, please. Ms. Moderator, can you please open up public comment for agenda item number 8?
Thank you so much. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and send it to all panelists, or you may simply raise your hand. We'll give you a moment. And I'm taking a little bit more time here just to make sure that I'm seeing everything that's there. And I don't see any requests for comments. So shall I close the Q&A panel?
Yes, please.
Okay.
And I saw Dr. Rogers. I see your hands up. Go ahead.
Yes. I was debating on whether or not I wanted to ask this question, but I thought, well, we're talking about the newsletter, so I might as well pose it. I'm wondering, I was just thinking about how informative the newsletter always is. But I'm also wondering if there are specific topics that licensees would like to see us address, and if it's in our purview to do so, if there's a way that maybe we can be more responsive to licensees' needs. So I'm just, for example, just wondering if there is a way that perhaps in the next journal we could, put a little section that asks licensees to weigh in on topics they would like to see us cover that maybe we hadn't thought of, just so that we can be as responsive to the needs of the licensees throughout the state. Thank you.
That's a great point. I agree with you that the newsletter has all this great information. So it'd be helpful to have it out for everyone to utilize. Ms. Riscate, do you have any other comments before we move on?
No comments or questions. Thank you.
Okay, thank you.
Dr. Tate, apologies for interrupting, but before you close out this conversation, we used to, as kind of a bookmark, have an ongoing little piece that was in all of our journals that said something to the effect of have an idea for a newsletter topic, and then it had to email the board. So I can follow up and make sure that we include that on our next newsletter, just so we have kind of an ongoing, platform for soliciting input and feedback on topics.
Right, because sometimes I think we get stuck in our own topics and there's other stuff going on out there, and it'd be great to have additional writers for the newsletter. So I love that idea.
Yeah, that's great. Thank you so much, Ms. Sorick.
Sure thing.
Okay, we can move.
I'm so sorry. I'm so sorry, Dr. Tate.
Go ahead, Dr. Rogers.
It just makes me think also, if we put that call out in our newsletter, could we also do that on our social media?
I definitely don't see why not. Yeah.
Just trying to make sure that we reach as many people as possible, for people to give their input. So, okay, thank you.
Absolutely. Okay.
Just one more plug. Maybe that is something that can be included in the president's message.
Oh.
In addition to it being a little, a tagline that's a bookmark for all newsletters, maybe it can be highlighted as part of the president's message.
I like that. Yeah. And that's easy to do, to implement into our next, the meetings upcoming. Okay, so we came up with several ideas on how to solicit more topics. Perfect. Thanks for bringing that up, Dr. Rogers.
Of course.
I'm going to move on to agenda item number 9, unless there's more chatter about the newsletter. Okay. Agenda item number 9 is the outreach activities update. Ms. Sorick, would you like to provide some details?
Yes, included in your meeting materials is an update for the current fiscal year of 23-24, which starts in July and ends in June of 2024. Currently, the board staff has attended one event. That was the California Psychological Association convention, which was held in San Diego, California. We have been very fiscally prudent with our budget over the past 3 years, and we are looking forward to starting to be able to attend outreach activities as our budget permits. We have important changes to our laws, including continuing professional development and, changes to processes and information in our licensing unit. So we had a great experience. We sent 4 staff to a CPA, and that was earlier this month, September 7th through the 9th. And we have an invitation that was just confirmed. We will be sending Ms. Chung and Ms. McCochran to the Los Angeles, California Psychological Association on October 21st. That will be held at UCLA. And the attendance is looking to be roughly the same amount, about 300 as CPA was. So looking at a wide reach of individuals to provide information to. Our goal is to update people on, licensing, renewals, CPD, and then also to solicit any interest in people that would like to be an exam developer, an expert working with our board for exams, as well as an expert reviewer for our enforcement program. So that is the update on that. Very exciting news, as we have not been in person doing outreach for many years. So this is an exciting development for the board. And I'm happy to answer any questions.
So thank you, Ms. Sorek. And I'm very excited that we can now, because we are the Outreach and Communications Committee, that we can actually start doing outreach activities. So I'm excited for October for the board staff. So Dr. Rogers.
I was going to say the same thing. It's really exciting to hear about the outreach that's happening and the invitation that you received from LA. So great work. I'm glad to hear about it. Thank you.
Ms. Riscate, any comments?
No comment, just thank you, same. Very exciting to hear. And kind of like makes more sense our title as a committee. Oh.
Exactly. Yes. So now we've been allowed to do outreach, so that, and it's been so many years. So that's perfect. Ms. Moderator, can you please open up public comment for agenda item number 9?
Thank you. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please.
Okay.
I see one comment from GK.
Oh,
hold on. Let me go back to there. Thank you. Thank you for seeing that. It sneaked in. So that's Dr. Andrea Davis. And give me a moment. I'll find you in my list. There we go. Dr. Davis, you should be able to unmute yourself.
Thank you so much for the outreach efforts this year to come to CPA convention and to be coming to LA County Psychological Association is just a wonderful way to intersect with your licensees and the members of those professional associations. So thank you very much.
All right, and our next request for public comment is from someone with the initials GK. So GK, hold on a moment. All right, GK, you should be able to unmute yourself. There you go. GK, can you hear us? Uh-oh. All right, GK, you are unmuted, but we cannot hear you. All right. So GK, if you'd like, you can type your comment in the Q&A and I can read it for you. We'll give you a moment. All right, so GQ or GK, excuse me, muted themselves, and I'm not seeing a comment appearing in the Q&A. Would you like me to just close the Q&A, or would you like to wait a moment?
Let's just give it one more moment.
Okay, sounds good.
Thank you.
You're welcome. Okay, so GK typed, it is regarding using LinkedIn. They also have a newsletter. So just pointing out, I guess, that LinkedIn has a newsletter.
Okay.
All right, would you like me to close the Q&A panel?
Yes, please.
You're welcome.
So the next agenda item is number 10, but I would like to take a brief break before we jump into this. This should be a robust discussion. So let's come back at 10:55. So it gives us about 15 minutes, a little less. So I'll see everyone back here at 10:55. Thank you.
This meeting is being recorded.
Thank you so much. It is 10:55. Ms. Pruteau, can you please call the roll?
Yes. Riscate?
Here.
Rogers?
Here.
Tate?
Here.
Roll is complete.
Thank you so much. Quorum is established, and let's dive right into agenda item number 10. This is review barriers to telehealth survey and identify next steps. Ms. Sorek, please.
Thank you, Dr. T. In 2020, a pandemic and nationwide protests regarding racial inequalities have highlighted the need for the Board of Psychology to consider how it conducts business and that impacts the profession of psychology and access to psychological services. As such, then Board President Seiran Fu and Outreach and Communications Committee Chair Dr. Leah Tate agreed upon the following areas of focus: updating continuing professional development regulations with the implementation plan to include written materials to highlight the cultural diversity and social justice requirement, increase stakeholder engagement, engage Department of Healthcare Services regarding Medi-Cal reimbursement rates, engage substance abuse and mental health services regarding federal initiatives addressing equity, and the digital divide. How does the digital divide impact access to telehealth? In particular, we will be discussing that today. On June 26, 2023, the board conducted a Barriers to Telehealth survey. This survey was a follow-up to the digital divide. The survey, which was item E, the surveys were sent to 30,000 consumers and providers of telehealth. The survey was closed on July 24th, 2023. The initial goal of the survey was to share the survey results to an organization that would write a white paper, which would include policy recommendations based on the survey results. The board reached out to both the University of California and the Little Hoover Commission. To date, no interest in a white paper has been expressed by either organization. The action requested from staff is to review the survey results and assign topical areas for each standing committee of the board to review, including but not limited to 1, review competency requirements for doctoral programs, training settings, and supervised experience for the licensure committee. 2, review compliance concerns in light of telehealth requirements, including HIPAA, Business and Professions Code Section 2290.5, and California Code of Regulations Section 1396.8 for Enforcement Committee. And number 3, engage in partnerships with stakeholders such as the American Psychological Association, the Association of Black Psychologists, the Association of State and Provincial Psychology Boards, the California Psychological Association, and the Trust regarding practice standards and best practices for the Outreach and Education Committee via webcasts, podcasts, newsletter articles, and social media. And last, number 4, provide insight from the survey results for purposes of the board's strategic planning session in December regarding telehealth and future practice issues. And then attached are the consumer survey results and the provider survey results for discussion.
Perfect. Thank you, Ms. Sorek. I don't know if anyone was tracking what was written down and what Ms. Sorek just said, but Mr. Fu and I started this in 2020. So to see this come to finally getting actual results back and 3 years later is incredible. And I'm happy that Mr. Fu is actually still on the board to see the results. It was a lot of reading, but overall it appeared to me that licensees were very expressive and honest with responses. And thank you, Ms. Sorek, for capturing the themes and whittling it down to 4 items, because there was a lot of information in all of those responses. So that's my initial thoughts. Board members? Go ahead, Dr. Rogers.
Oh, thank you, Dr. Tate. Thank you, Ms. Sorek, for this. And thank you, Dr. Tate. And thanks to Mr. Fu for all of your efforts way back when in 2020. I was really surprised and heartened to see how much input we got from licensees. I think it was about 4,000 licensees who responded. I am wondering a couple of things. Ms. Sorek, could you talk a little bit about in the action requested? I'm curious mostly about number 3. So engaging in partnerships with stakeholders regarding practice standards and best practices. Could you speak a little bit more about that piece, what you're envisioning?
Absolutely. The way I'm looking at items 1 through 4 is almost in sequence. And I think 2 and 1 are a segue into 3, so that based on the licensure committee's review of requirements in programs, supervised experience, training, and then looking at our current laws and regulations surrounding telehealth and federal requirements. I think that is the foundation to creating some information and being able to share that at the level of the Outreach and Communications Committee. So once the kind of policy committees do some of the groundwork and identify areas that we need to communicate, then, you know, you guys as a committee can come up with how that information comes across and what platforms to utilize in order to get that communication across, if that makes sense.
Yes. Okay. Okay. Now that's making sense. Okay. That's helpful. And then when you said that, it made me think of another question. So if 1 and 2 will be sort of connected to the licensure committee and then the enforcement committee, and then that informs what we do as the outreach and communications committee, I'm assuming we're talking about when we meet next year. So tell me what your thoughts are about how we'll discuss this as part of our strategic planning meeting in December in number 4. Does that make sense? Because that will be happening before we meet as a committee again.
Right. So I think that's great because part of this committee's work is reporting to the full board, which will happen in November. So if the committee comes up with action items to bring to the board in November, that can help lay the groundwork for what December's strategic planning process looks like.
I see.
And then that can inform the work of the first 2 committees and then you guys in the fall.
I see. Okay.
If that makes sense. And that's something that we can, once it's in a strategic plan, then it can become part of an action plan, and then we can actually develop, you know, goals and action items to meet each criteria.
Yes. Okay, great. Thank you so much, Ms. Sorg. That's really helpful. I appreciate it.
Sure. No problem.
Ms. Riscate, any comments, thoughts?
Mainly that this is like super informative, and it kind of like resulted kind of like some of the things that I thought would be said were said, and you know, that obviously it does extend and make mental health services more widely available for various people, whether it be time, disability, or just anxiety. Maybe they don't want to leave their house. But then, just like really highlighting the concerns that even though the percentage that say they're comfortable with it, it is important to consider, like, you know, when we do our planning, the lower percentage that does want to still have in person. As someone, and you know, and also who sometimes seek to mental health, I do see how people are kind of like using kind of like outsourcing and making telehealth like the priority. And I see that in the survey results that other people are noticing that as well. And also just the quality that you get. It doesn't matter if it's telehealth, but for whatever reason, some people, the providers themselves are often, you do see some of them are just distracted and they don't treat it with the same respect. So I'm glad that we'll be discussing kind of like that as well, like training and as part of our plan, and that providing services, whether on the phone or in person, that it's similar, but that it seems like the way things are going, that kind of has to be part of training as well. I'm like, there has to be reminders that you're literally doing the same thing, you're just at home on a computer. So yeah, I'm just really really excited that we're going to be working on this and hopefully being able to provide more equal amount of services for everyone.
Perfect. Thanks, Ms. Riscate. I agree with you. I'm actually happy that all aspects of the board are going to have a hand in this, the review process. So I'm happy licensure is involved and enforcement and us, and I'm glad that we can discuss this in December. Oh, hi, Dr. Rogers.
Oh, sorry. Again, trying to decide if I wanted to share this or not. I thought the feedback on question 8 was, it's all illuminating. Let me just start there. What I thought was interesting about question 8 related to training barriers, it seemed like there were 2 sets of responses. It seemed like some folks responded related to training that they have received around the provision of telehealth as practitioners. And then it seemed like there was another subset of responses around the impact of telehealth on trainees that are up and coming psychologists. So I thought that was a really helpful distinction. And I just want to make sure that we pay attention to both as we talk about it in our strategic planning meeting, and then perhaps as we share more information with the full board in November. Thank you.
Oh, thanks, Dr. Rogers. Is there a motion in our board members before I open it up for discussion?
I can make a motion. I'm trying to
see how to formulate it.
The best way to say it. I am in agreement with the staff recommendation. Let's see.
Ms. Bond, is there a way to make this motion more concise, or does Dr. Rogers have to read all 4 points?
I'm going to check in with Antoinette on that because of the of which the 4 points are in the materials here.
Oh, okay. Thank you.
Let me see.
I'm wondering, Ms. Bond, if it would be acceptable for Dr. Rogers to approve the staff recommendation to be the committee recommendation or consideration at the board's November meeting.
That's certainly, yes, that's perfect.
Okay. So I am.
In fact, you could say so moved.
So moved.
And I'll second. I'm happy to do that. Ms. Riscate, any other comments before I open up public comment?
No other comments. Thank you.
Thank you. Ms. Moderator, can you please open up public comment for agenda item number 10?
All right, I have opened up the Q&A panel. If any member of the public would like to comment, please just type comment in the field in the lower right-hand corner of the screen and submit it to all panelists. Or you may simply raise your hand. We are displaying instructions and we'll give you a moment. All right, I do see a comment in the Q&A from GK. GK, I just gave you permission to unmute if you would like to comment on this agenda item 10. Not sure if your comment in the Q&A pertains to that. All right, I am not seeing any requests for public comment. Would you like me to go ahead and close the Q&A?
Yes, please.
Okay.
Thank you so much. So we have a motion and a second. Any other board comment? before we call the roll?
Nope, not for me.
Thank you. Ms. Pruteau, can you please call the roll?
Yes. Rescate.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you.
Thank you. Motion passes. We're moving on to agenda item number 11. This is recommendations for agenda items for future committee meetings. The committee may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. I'd like to open it up to board members. Any topics for our next year's meeting? Dr. Rogers, go ahead.
Yes, I am thinking a lot about this survey, and I'm really thankful for the amount of feedback that we received. I'm just thinking about the small number of responses that we got back from clients of psychological services. And I'm thinking about our role as the outreach and communications committee. I'm really thankful that we are participating in professional meetings like with CPA and the LA County Psychological Association. But I'm curious about our outreach efforts for consumers. And so I'm wondering if we could have more discussion around what that could look like moving forward, just so we are engaging with consumers of psychological services, since we are a consumer protection agency. Thank you.
Good suggestion. Ms. Rescate, any comments or suggestions?
Not a separate agenda item, but just some of the stuff that I mentioned earlier for the website review, just adding some more analytics so that we know where people are finding our page, whether it be going directly to the page or coming from social media. I think that would be beneficial in letting us know where is the best place to put a lot of effort in reaching people. Mm-hmm. And
you also have the LinkedIn suggestion too.
Yes, and the LinkedIn suggestion Dr. Rogers had brought up. And also, and the third item would be the resharing the statistics from this meeting in the social media update, so we can at least see the change over a year in terms of increase.
Yes, thank you. Those were all great suggestions.
Thank you.
Dr. Rogers, is that a lazy hand that you forgot?
It is a lazy hand. I am so sorry.
Not a problem. Ms. Moderator, can you please open up public comment for agenda item number 11?
Thank you. I've opened up the Q&A panel. If any member of the public would like to suggest agenda items for future meetings, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. We are displaying instructions, and we'll give you a moment. And I do see that Dr. Davis has a comment, so one moment, Dr. Davis, and I will give you permission to unmute. All right, Dr. Davis, you should be able to unmute.
Thank you. I was trying to get in with the last agenda item, once again, one behind. I'm very intrigued by the results of the telehealth survey, and I wanted to understand what maybe in the future agenda for this committee to share what the plans are to incorporate the feedback and make, adapt the strategic plan relevant to all the comments and input and suggestions you got through the telehealth survey, barriers to access survey.
All right, thank you. Our next request for public comment is from Michael Pines. Michael, you should be able to unmute yourself. All right, Michael Pines, you should see a prompt. There you go. Michael, you're unmuted. looks like he accidentally muted himself again. We'll try that one more time. Technology. All right, Michael Pines, you should be able to unmute yourself. Try that one more time. Maybe that was a accidental hand raise. All right, I think that was an accidental hand raise. I'll check the Q&A one more time to make sure we've got everyone. All right, I don't see any more requests for comment. Shall I close the Q&A panel?
Yes, please. And thank you for your help today.
Oh, you're welcome. All right.
So that is all of the agenda items for the Outreach and Communications Committee meeting for today, September 22nd. Ms. McCochran, can you please jump on and let us know what it looks like for CPD credit today?
Yeah, so if you stayed for the full duration of the meeting, you will receive CPD credit for 1 hour and 30 minutes under category number 1, attendance at a California Board of Psychology meeting. For your records, please notate today's date as September 22nd, 2023, and the name of today's meeting, which is Outreach and Communications Committee meeting, and the 1.5 CPD hours. If you called in for the meeting, email bopca.ca.gov with your name and the number that was used to call in to ensure that your attendance is accurately recorded. Back to you, Dr. Tate.
Thank you, Ms. McCochran. Ms. Bond, do we need an official motion to adjourn for the day?
Oh, Dr. Tate, real quick before you...
Oh, go ahead.
Go ahead, sorry.
Sorry, before we conclude, I just want to remind folks that the board will meet next on November 2nd through the 3rd in Los Angeles. The meeting location, we are working to confirm, but folks can check our website address, psychology.ca.gov, and click on board meetings from the homepage. And we will have all of our board meeting locations posted as soon as they are confirmed. So just that quick note.
Thank you, Ms. Orrick. Ms. Bond?
And no motion is needed for an adjournment. Thank you.
Oh, well, I just want to say thank you to everyone who attended our meeting today. We appreciate all the involvement and we enjoy the public comment. I hope everyone has a great weekend and this meeting is adjourned.